Who should not use ThermaCare? Patients should not use therapeutic heat wraps in the following situations. 1. If heat cell contents leak or the wrap is damaged. 2. For more than 8 hours in any 24-hour period. 3. With such medications as pain rubs, lotions, creams, or ointments. 4. If skin is unhealthy, damaged, or broken. 5. If skin is bruised or has inflammation that began within 48 hours. 6. On any area of the body that is insensitive to heat. 7. With any other heat-producing product. 8. If the patient is unable to remove the product, example all infants, some children, and the elderly. 9. If the patient cannot follow all instructions. Patients should speak to a physician before using heat wraps if they have diabetes, heart disease, poor circulation, rheumatoid arthritis, or are pregnant. Patients should stop use and see a doctor if the pain worsens or persists for longer than 7 days, or if they experience discomfort, burning, swelling, rash, or other changes in the skin that persist in the area where the wrap was applied. Products are available for application to the following areas: lower back and hip, neck, wrist, and shoulder, knee and elbow, and various muscle areas. Patients wearing heat wraps are fully mobile, so they can continue to play sports or go to work as usual.